My name is Charlie Smith. I'm a physician. I'm affiliated with the University of Arkansas for Medical Sciences. It's located in Little Rock. And I also am the founder of a company called eDoc America, which I would encourage you to take a look at the website edocamerica.com. We're going to talk today about how to become and stay fitness. It's something that a lot of my patients struggle with, and as an active fitness advocate, I've had a little bit of experience in this area, so I'd like to spend a little while talking about this today. First of all, it's important to understand that fitness has probably more health benefits than just about anything else I can prescribe as a physician. So it's really definitely worth the time and effort to achieve fitness. And majority of patients are not fit. Even those patients who exercise on a regular basis don't have a real firm understanding of what physical fitness really means. But fitness is a hard job. To achieve fitness, to become fit, is an extremely difficult thing to do. It's a hard job, and it takes time. How long? If you start from scratch and work hard, it takes a minimum of 12 weeks to become fit. Another thing to think about before you start a fitness program is to make sure you have adequate health screening. And so if you don't have a family physician, you need to go in and see your doctor, get a physical exam, and some basic evaluation to determine whether or not you're sufficiently healthy that you're not going to put your health and your heart at risk if you undertake a fitness program. The other thing that to be important to be noted about fitness is that it really consists of at least two major components, and one is what I'll call an aerobic component, and the other one is what I would call a non-aerobic component. And for purposes of real generalizing, and for today's discussion, I will say that aerobic component is something like running, biking, or aerobic machines such as treadmill or elliptical machines. And non-aerobic fitness is are things such as stretching, yoga, weights would be the main thing that I would relate. So let's start by talking about the aerobic component of fitness, which really in many ways equates to cardiovascular fitness. And by that I mean that your cardiovascular system, as it becomes fit, can allow your body to do more work at the same effort level. Let's first talk about frequency and duration of exercise. It's common that patients will say they work out 3 times a week and think that's enough, and that they work out for 30 minutes a session. Is that adequate? Well, the answer is no, it's not. In my opinion, a minimum fitness routine needs to work up to 5 sessions a week for at least 45 minutes per session. And ideally, you would have some exercise every day, but you'd have a good aerobic session at least 5 times a week for 1 hour. Now, that's not necessarily a requirement, but if you want to really optimize your fitness, I would shoot for that. But so what I would really think would be a practical goal that everyone who is reasonably healthy can achieve is 5 times a week, 45 minutes per session. All right, so that's frequency and duration of exercise, and there's also always a lot of confusion about level of intensity, and let me just say that I think that patients generally don't work hard enough when they exercise. Exercise can be fun, but exercise is work. So think of exercise as your daily work, and you'll get used to it and look forward to it, but it won't be a walk in the park. It will be a hard session where you go out and you sweat and you get tired and you are looking forward to the end of your exercise session. It's okay to look forward to the end of your exercise session. So what does this actually mean in terms of intensity? We have a range called the aerobic range, which is achieved by measuring the heart rate. And so how do you measure the heart rate? I want to say that the easiest and most efficient way to measure heart rate is to get a heart rate monitor. These can be purchased at a fitness shop, athletic outlet for maybe $75. You can learn to take your pulse, stop, take your pulse. That's a major hassle. You can also use the perceived exertion scale, so-called board scale of perceived exertion, and bikers, like spinning classes, will often use this in, say, exercising at a rate of 7, 8, or 9, or 10, where 10 is the maximum, 9 is near maximum, 8 is moderately uncomfortable, 7 starts to get comfortable, 6 is comfortable, 5 is kind of cruising. But it takes a while to get used to that, and it's not very precise. So it would be great if you could obtain a heart rate monitor, and then you know exactly where you stand. So then, where do you keep your heart rate? The aerobic range that we recommend is between 60 and 80% of your maximum heart rate. And so how do you figure out what that is? I like to use the formula of 220 minus your age as your maximum heart rate. So let's just say, since I'm 61, so 220 minus 61 is 159. So then I would take 159, and depending upon what level I want to exercise at, and say 60% would be the lower range, 80% would be the higher range that you'd work out in. So let's use 70% as our average workout heart rate is 111 beats a minute. Now, I will tell you that I usually work out at a heart rate of 130 to 135 beats a minute, which is pretty close to 80 to maybe even 85%. So therefore, if you're 61 and you work out at 80%, you're going to be in the range of 130. And if you want to work out in the range of 70, you're going to be at about 111. And if you're at 60, it'll be closer to a heart rate of about 100. So we're going to stop there for today, and next time we'll talk about some other aspects of fitness and expand the concepts a bit. Thanks.